Okay, so how do nutritional needs change throughout the lifespan or throughout growth and development? I want to start with pregnancy and lactation. In pregnancy, there are increased requirements for calories and for nutrients, in particular protein, folate, and iron. In lactation, those increased nutrient requirements continue. So pregnancy and lactation. On average, pregnancy requires about 300 more kilocalories per day and lactation about 500. There's an increased fluid requirement because blood volume increases by 50%. So we need more fluid to meet that increased blood volume. There are some things that we recommend people who are pregnant or lactating avoid because of potential harm. One of those is alcohol. Alcohol in pregnancy is associated with fetal alcohol syndrome and fetal alcohol effects, which is a cluster of neurologic and developmental complications that can occur in childhood as a result of alcohol exposure in utero. We recommend that people in pregnancy limit caffeine to moderate use. Excessive caffeine has been associated in some studies with miscarriage, but moderate use has been shown to be pretty safe. We recommend that people who are pregnant avoid unpasteurized soft cheeses and lunch meats that might carry listeriosis. And we recommend that they limit certain types of fish because of the mercury contamination. We might also in pregnancy be helping patients to manage the gastrointestinal discomforts of pregnancy. Nausea and vomiting are common, especially in the first trimester. So we may have some interventions trying to relieve those because those can actually affect nutrition negatively. Heartburn can affect intake. Sometimes people with heartburn actually keep taking a lot more calories because they are either drinking or eating something that soothes that temporarily. Constipation is also common in pregnancy because the GI tract slows down to allow for maximum absorption of nutrients. So we may be helping patients manage those discomforts in order to maximize their nutrition. One specific note, if a mother has PKU, then she needs to avoid phenylalanine throughout pregnancy because excess phenylalanine could cause neurologic damage for the fetus. The next stage is infancy. Now the baby is born. Infants grow very rapidly, so their caloric need is high in relation to their size. The gut is immature. A newborn infant gut is able best to digest and absorb the nutrients from breast milk. The only acceptable alternative is commercial infant formula that should be iron fortified for the first 4 to 6 months. Okay, first 4 to 6 months, breast milk or formula, that's it. They don't need water, they don't need juice, they don't need additional foods during that time period, and their gut is not really prepared to digest those things. Giving infants under 6 months just plain water is associated with decreased sodium levels and water intoxication, which has led to seizures and death for some infants. That happens sometimes when people think they need to give the baby a bottle of water. Sometimes it happens because people are trying to make that formula stretch, and so they dilute it more. And they increase the baby's water intake. Juices are associated with increased risk for obesity. So juice should really be considered like a treat, an occasional thing, not a daily necessity. And no additional foods are needed for 4 to 6 months. So around 4 to 6 months, then it's recommended that we begin adding some other things to that infant's diet. Some experts recommend starting with those iron fortified cereals because they're less likely to trigger allergies. Some people now are moving toward especially if they're waiting more toward that 6 month end of things, then they may be offering some soft cooked vegetables and fruits and things like that instead. Cow's milk should not be given to infants under 1 year old. The protein level is too high, and the infant kidneys are immature, so the kidneys can't really handle the amount of protein. And cow's milk actually doesn't have enough fat. Newborns need a lot of fat. Cow's milk is perfectly formulated for baby cows, but not for baby humans. That's why when we feed cow's milk to infants, it needs to be changed. It needs to be altered to be a formula that can be digested and absorbed by humans. Cow's milk can also cause microscopic GI bleeding. So in toddlers, sometimes we see anemia in toddlers who are drinking lots and lots and lots of milk, especially after they switch to cow's milk, because formula is really expensive. And so there's two things. One, they've replaced formula, or breast milk, which has all the necessary nutrients, with cow's milk, which doesn't, but they're drinking so much cow's milk that they're not eating a lot of food. So they're missing out on some nutrients that they would be taking in, but also they can actually have microscopic bleeds and have a little bit, develop anemia from that. We also need to think about allergies with feeding infants, but that's actually gotten more complicated. At one time, many moons ago in the dark ages when I was a baby, my mother was told to feed me oatmeal at 2 weeks old. And it was my first allergy. And they figured out at some point that if we feed babies too early, we're going to cause them to have allergies. And so then they found all the most highly allergenic foods, and their recommendation for a long time, this is when I was raising my kids, was that you don't give them any of these highly allergenic foods until they're like a year old or 3 years old, or there were all these deadlines. Well, then it was found that if we wait too late to introduce foods, that also makes allergy more likely. So there's kind of seems to be a window between around 6 months or so for introducing new foods that minimizes allergy development. Some breastfeeding basics. If the parents are going to breastfeed, it tends to be, these are some things that can help it be more successful. They are not always possible. And just because the mother cannot do some of these things doesn't mean she's not going to be able to breastfeed successfully. But if possible, we want to have them offer the breast to the baby as soon after birth as they can. That's, of course, assuming both are stable. Frequent feedings increase milk supply. So sometimes moms are told, don't feed the baby too often. You make them too dependent. They're using you for a pacifier. They're going to drain out all your milk. The reality is the more often that baby is at the breast, the more milk they're going to make. And so we want to encourage them to feed frequently, especially in the first few weeks. Newborns may nurse every hour or so in that first few weeks. And then once they kind of settle into a rhythm, they suddenly change the rhythm because they've got a growth spurt. So then they increase the frequency again for a growth spurt. Milk is produced on a supply and demand basis. So the more the baby nurses, the more milk they get, the more milk that the mom will make. We want to teach parents to observe for early signs of hunger. Babies will often root or kind of grunt or make little noises when they start to get hungry. Usually you're more successful at getting them latched on when they're a little hungry instead of waiting until they're starving and screaming and frustrated. We want to teach the parent to nurse until the infant is finished feeding. If they slow down, burp them and put them back and see if they want to go a little bit more. So we don't have to have timed feedings. If they're concerned about their breast size being uneven, we would encourage them to alternate which breast they feed from at each feeding, because they tend to take more from the first breast than from the other. But mothers who only have one functional breast are often able to breastfeed their babies. Comfort nursing increases milk supply. Sometimes women are encouraged to not comfort nurse, give the baby a pacifier if they're not actually hungry. Eventually that may be a useful suggestion, but in those early weeks when we're trying to establish milk supply, comfort nursing is not a bad thing. It actually improves milk supply. A demand schedule promotes a good milk supply, and it allows the infant to follow their own hunger and satiety cues. Now, in the early days, in that first few weeks when they're just getting woken up and ready to go and learning how to do this, sometimes maybe babies need what we call a modified demand feeding schedule. And that means that if they wake up or if they want to nurse, we have the mother go ahead and nurse them. But if they don't want to nurse, if they don't start fussing or showing that they're hungry, there's a certain length of time we don't allow to go by. So if it's been longer than 3 or 4 hours, maybe we want to have them all offer the breast anyway, even if the baby's not showing signs of hunger. And that's because some babies are just kind of sleepy at the beginning, and if you don't wake them up to nurse, they'll go too long and lose too much weight. We want to teach safe storage and handling of breast milk. And we need to know, and parents need to know, that breastfed babies sometimes need vitamin D supplementation. So what if they're not going to breastfeed, if they're going to use formula? We need to teach them how to handle and store formula safely. They should use iron fortified commercial infant formulas. Homemade formulas do not have adequate nutrition, and they may be dangerous. For powdered formulas, most common because it's the cheapest. First of all, powdered formulas should not be used by babies who are at high risk of infection. They're fine for full-term babies, but like a preemie should not get powdered formula for the first few months. So if they're going to make powdered formula, number one mistake is to put the formula powder in the bottle and then fill it up to the ounce line, shake it up. Okay, they're actually making that formula too concentrated. Typically, the ratio is 1 scoop of formula. The scoop comes in the can to 2 ounces of water. So they put what you want to have them do is put the water in the bottle first and then add the powder. So put the 2 ounces of water in, then the 1 scoop of powder, mix it up. If it's over diluted, if they add too much water, that can lead to water intoxication, failure to thrive. It can actually lead to seizures. Babies have died from it. If it's too concentrated, it can cause diarrhea and they can become dehydrated. We want to discourage bottle propping. We want parents to hold the baby while they're being fed, as if at all possible. Bottle propping is an aspiration risk, especially for littles. It allows formula to pool or milk to pool around the baby's teeth and cause baby bottle caries. Also, feeding is a chance for someone to get some rest, to sit down and just relax a little bit, and it's bonding opportunity. So we want people to avoid propping those bottles. Some potential nutrition problem for infants, colic. Colic isn't necessarily a nutrition problem, but colic is a diagnosis of exclusion. If a baby seems to be in pain, it needs to be evaluated. Colic is when they've ruled out all of the physiologic causes they can think of, and the baby still seems to be in pain for usually it's the same time of day for a couple hours. It's very stressful for everyone involved because they cry and cry and cry, and it's very hard to relieve them. Sometimes colic can be due to gassy tummies and things like that. So there are some different interventions that may help, but the number one thing is if parents say a baby is colicky, we really need to be evaluating to make sure there's not something else causing that before we just say it's colic. We need to be aware of food allergies and intolerances. So if a baby's breaking out or having GI symptoms whenever they have a certain food, that needs to be reported. Need to figure out if it's due to that food and maybe avoid it. Failure to thrive is when they're not getting enough calories for growth, and that most commonly is from inadequate intake. It can be because of poor absorption. So failure to thrive needs to be evaluated. Diarrhea babies are going to dehydrate very quickly. So diarrhea needs to be monitored carefully in infants. Constipation, it does not happen in healthy breastfed babies. They may go several days without a BM, but when they have that BM, it's passed easily and it's soft. If a breastfed baby has true constipation, so they're having difficulty passing hard stools, then something is wrong. Okay. Formula fed babies are more likely to get constipated because it's digested just a little bit differently. There's a lot of advice about constipation. One thing that people are often told is give the baby some water with Karo syrup in it. Please don't do that. Please tell parents not to do that, because first of all, we're risking water intoxication because we're adding that free water, but also Karo syrup, honey and syrups are a risk for infant botulism. So they shouldn't be given to kids under a year old. So constipation needs to be probably monitored by the pediatrician. Okay, next age group, told y'all this was a longer one. Toddlers. In toddlerhood, growth slows some. So we run into this kid that we were feeding, they ate, good baby, they ate all the time, everything's great, to now they're just not really interested in eating. And their appetite decreases because their growth has slowed down a little bit, but it happens at the same time that they start figuring out, I'm a separate person. And so they're testing out that boundary of what they can decide and what the grown-ups decide. So meal times can become a major, major battleground because people are afraid, oh my gosh, what are they going to say? I can't get my kid to eat. My child's going to starve to death. Healthy neurotypical toddlers will not generally starve to death voluntarily. So there are some things we can teach parents about dealing with that. One way to handle that, and probably the best way, is the parents decide what's available for the child to eat, and the child decides whether to eat or not. Something that some parents feel really a lot better about those picky toddler years, if their child's still breastfeeding or getting some formula. There are some toddler formulas, so they have more complete nutrition while that kid's learning to eat a little bit. Toddlers over a year old can have cow's milk, but they should not have skim or reduced fat milk. They should be getting whole milk until they're 2, because they need that fat to finish myelinating their nervous system. Okay. Choking hazards are something else we need to teach parents about. If it can go through a toilet paper tube and it's hard, they probably don't need it. So think about hot dogs. How would you serve hot dogs to a toddler? Never mind the nutritional value. If they're going to eat a hot dog, how are you going to serve it to them? You want it to be cut into irregular chunks that are not the right size and shape to block their airway. Would you give a toddler baby carrots? Probably not, because they're going to bite off a chunk of that. Again, it's perfect toddler airway size. So think about popcorn and things that are all choking hazards. Toddlers tend to like finger foods. We want to give them foods that they can eat on the go, or they can pick up and feed themselves. They're learning to use a spoon and fork, but it's a lot of work to get something to their mouth that way. So they might get more in if they can pick some of it up with their hands. Juice in toddlers is associated with the risk of obesity. There are some potential nutritional problems in toddlerhood. Anemia and vitamin D deficiency are some of the most common. So preschoolers. Their growth rate continues to slow down. So they were growing really fast as babies, they gradually slow down, and then they have this spike in growth rate in adolescence. So preschoolers continue to slow down their growth. Pickiness continues. Food jags are really common, where all I want to eat is a peanut butter sandwich cut in triangles, and that's all I'm going to eat ever for like 3 weeks, and then they switch to something different. So that's really common, typical behavior. We want to encourage parents to use the same process. The parents decide what food's available, the children decide what and whether and how much to eat. If the parents are only making or mostly making healthy foods available to that child, then when they do eat something, it's not going to be, if they're going to eat 5 bites in one day, let's not make it a Little Debbie cake. Okay. If they eat 5 bites in one day, let's make those 5 bites count. So we want parents to make healthy foods available to the child, and then let the child decide whether and how much to eat. If we make food not a battleground, they tend to work through that and become better eaters. Some potential nutrition problems. A lot of parents don't adjust their expectations. They're used to that baby appetite. And so they want to keep increasing the amount of food they offer to toddlers and preschoolers, and they actually overfeed. And so you have, again, a battle over what they're going to eat, or you have the kid that keeps eating that and develops excess weight as a preschooler. There are a lot of calorie-dense, nutrient-poor food choices out there marketed to preschool, toddler, preschool, school-age kids. So lots of the things out there are really not, don't have a lot of nutrients, and they have a lot of calories. Anemia continues to be an issue, especially if they're drinking a lot of milk and not taking in a lot of other food. Lead poisoning, because toddlers and preschoolers now will pick things up and put them in their mouths. If they're exposed to, like if they're in a place with flaking lead paint, this is a really common time that we see an increase in lead poisoning. For school-age kids, their growth kind of has slowed down until they get that pre-adolescent growth spurt. So just before they hit puberty, they kind of hit a growth spurt. They may gain weight first and then get taller. They may get taller and then gain weight. But either way, they suddenly start requiring more calories. But sports, even before they hit that growth spurt, sports increases their need for calories, fluid, caloric intake. So if they're really active kids involved in a lot of sports, they may eat a lot because they're burning a lot of calories. Not all kids are active. If they're kids that are sitting and playing video games or doing indoor things, reading, things like that all the time, then their caloric need doesn't increase as much until they hit that growth spurt. We want to focus with school-age kids. They can understand now a lot of nutrition teaching. We want to teach them how to make good nutritional choices. One of the things we want to teach them is to focus on eating when they're hungry. Food is about when I'm hungry, not I sit down to watch TV and I have to have a snack. So help them learn to eat for hunger, not for non-hunger cues. Some potential nutritional problems: overweight, obesity, and also skipping meals, in particular breakfast. And the kids who skip meals may also be overweight. They still don't need to skip meals, okay? They need to be eating healthy meals through the day. Adolescence, now we've hit the growth spurt. And if you've had a teenager in your house and tried to feed them, I swear my 14-year-old eats like 6 times a day. He eats, a lot of times he's eating as we walk out the door. He usually eats breakfast at school. He eats lunch at school. He either takes a snack or buys a snack to eat after school for workouts. Probably eats another one sometime during the day. I don't know. Comes home, immediately goes to the kitchen, eats a snack. When I make dinner, he eats dinner. And when I go to bed, he's usually eating second dinner at that point. And that's a really common pattern. He's also an athlete and he's super skinny. So I know, he's using all of it, but that's a really common pattern. That growth spurt hits, and especially if they're active kids, they're just starving all the time. Also, their eating habits are influenced by peers and by other things in their lives. So they may primarily, up until this point, have had healthy choices available to eat. Now they're spending more time with their peers. They've got club meetings, they've got practice, they've got going out with their friends. And so there's more opportunities to eat other things. And they get busier. This is when that we're busy and don't have time to eat healthy sometimes starts. Sometimes it starts even earlier than that in the school age years. Some potential nutrition problems for adolescents. Adolescent eating patterns can be nutrient poor and high in empty calories. So they're living on pizza and ramen, and I try to keep a bowl of fruit out because they'll run by and grab that for a snack at least some of the time. They have an increased need for iron, but sometimes their eating choices have changed and they're not getting enough iron. So they need more iron, they may be getting less. So anemia is not uncommon. Lifetime bone density. We make our bones are as dense as they're ever going to be in adolescence. We put all of our bone down in adolescence. So if we're consuming sodas and not getting enough calcium during those prime bone formation years, that can affect bone density long term. Okay, and carbonated beverages have been associated with lower bone density. We may see adolescents who become pregnant. So now we have the additional nutritional needs on top of the additional needs for growth for adolescents. We may have athletes who are using supplements that may or may not be healthy. Some of those can actually be pretty dangerous. And also maybe on restrictive or on diets trying to gain weight or to gain muscle. We also may see adolescents with really unhealthy weight loss diets, trying to lose weight or maintain weight in really unhealthy ways. And we see eating disorders come out of that. Adults, so we graduate high school and we go either out into the world and work or go to college, but our lives change. And our activity levels usually go down. After high school, our activity levels usually decrease unless we work in a really physical demanding job. But even then, our activity levels usually are lower than they are as adolescents. So that means our caloric need decreases. Well, most of us don't decrease our intake when our activity level changes. Metabolism also starts to slow down as we age. So 30, 40, 50, it's getting slower. Some potential nutritional problems. So all of the poor nutritional choices we've made through our lifespan begin to hit around middle age. That's when we begin to see the results of those things, and then we can't go back and fix them. Obesity is becoming more and more common in our culture, partly because of the foods that are available to us, partly because of our work-life balance. Sometimes elders aren't getting enough calories or enough nutrients in, and there can be a lot of reasons for that. There are social factors that affect what food is available, whether there's enough food available, whether that food is consistently available. We may not have a lot of people who are just continually starving in the US. We do have a lot of people who are food insecure. And food insecurity actually often leads to obesity, because if I don't always know if food's going to be there, when it is there, I'm going to eat it. That starts in childhood, but it really comes home to roost in adulthood with the consequences of that. Hydration, most adults are not getting enough water. We're too busy, also too busy to go to the bathroom, so we don't drink enough water because of that. So hydration is a major factor. And then we start to get more and more medical conditions as we age that are going to affect nutrition. All right, the next recording is going to be over basic therapeutic diets.